Well, thank you so much for having me. What an opportunity. I've never seen such collaboration for something that I'm so incredibly passionate about in one room, and my cup is so full from just this morning, so I'm excited to be here and appreciative for the opportunity. My passion for kind of this advocacy started very early on in my second year of medical school. I have a bachelor's of science in psychology that I got in undergrad, so I've always been interested in mental health, but my passion for advocacy really started early in second year. I was studying late one night and I got a phone call from a first year student at about 2 o'clock in the morning. Obviously, I was awake because I was a second year medical student. And I said, what's going on? Is everything okay? It's 2 o'clock in the morning. Why are you calling me? And he said, I've got another first year here with me and she's saying some really scary things. And I don't really know what to do. I don't know where to go. She says she doesn't want to be alive anymore. She's ready to kill herself. And so I was terrified. It was 2 o'clock in the morning. And he was like, he didn't know where to go. He didn't know what to do. He just knew that I was their student government president and he had my personal phone number. So he called me. And I said, well, I can't really do anything for you. This is a medical emergency and you need to go to the emergency room. And if she's not willing to do that, then you can call 911 because this is a medical emergency. But keep me updated, let me know. So I didn't get any updates till 7 o'clock that morning. So it was a tired day the next day. They made it to the emergency room, but never went inside. They stayed in the car. He stayed with her that whole night. And I'm so grateful for him. We are such a tight community at OSU that these are my family members. And he stayed up with her all night long and talked her down from this crisis point. But I could have so easily lost a family member that night. I mean, if she had been alone, if she had lied and said she was fine. And so I knew that I needed to do something. I just didn't know what. So then I got involved with the Council of Osteopathic Student Government Presidents. And I heard this presentation where they had surveyed 11,000 osteopathic students and found that on average, we had these profoundly higher rates of depression and anxiety and suicidal ideation. And I was like, these aren't just numbers. This is a phone call that I got at 2 o'clock in the morning. And so I knew that I needed to get involved at an executive level. And that's when I ran for the vice chair position. So we did another survey this year because as soon as I got the position, I was like, I want to help. I want to provide resources. I want to save everybody. But I realized just like in healthcare, I needed to know where we were. You can't just take them straight to the OR. You need to do a thorough history and physical first. So I wanted to take the pulse of what students had currently, what resources they had, what resources were working, what did they need. So we reached out to the student leadership on all of the campuses and asked them these questions. And we got pretty incredible data back about the cultural change that's already going on campuses across the nation. And a lot of minute things that we didn't think about. I think the best example was our college has great resources, but our counseling center has glass walls. So no one will go to the counselor because they can see us when we go. So it was little things like that we found through this survey. And we managed to take it to our leadership. We took it to our accrediting body, the COCA, and we took it to our board of deans. And they were so receptive and so supportive. And we've already seen these incredible changes where they are making new accreditation standards for schools that you have to have this, this, and this to be an accredited college of osteopathic medicine because the students need our help and they deserve to have this support from their colleges. So, thank you.